stroke a spiritual attack? No. Can stroke be spiritually sent to you? No. Can village people cause stroke? No. Can overthinking cause stroke? No. So what then causes stroke? You get all the answers in this video. Welcome to Mind, Soul and Body with Obii. This is a health, education and wellness channel. If this is your first time on my channel, you are very much welcome. Please subscribe to my YouTube channel, tap on the notification bell so that you instantly get notified anytime I upload a new video. For my returning subscribers, thank you so much for stopping by. In this video, we're going to be talking about stroke. We're going to learn what causes stroke, the prevention of stroke, the treatment of stroke, the diagnosis of stroke, the risk factors for stroke. You get all your answers about stroke in this video, so stay tuned. Stroke occurs when there's an interruption in the blood flow to the brain. This could be due to a blockage or a bleeding in the vessels of the brain. The brain needs a constant supply of oxygen and glucose in order to function appropriately. Blood rich in oxygen and glucose travels through the blood vessels to your brain. When there's an interruption in the blood flow to your brain cells begins to die, and this could result in a stroke. Types of stroke. First, the ischemic stroke. This is the most common type of stroke, and it accounts for 85% of the cases of stroke. So the word ischemia means inadequate blood supply to a particular organ or part of the body. In essence, ischemic stroke occurs as a result of inadequate blood supply to the brain, which occurs due to blockage of the blood vessels that supply blood to the brain. So this blockage of the blood vessels is actually caused by fatty deposits or plaques or blood clots. So most times these blood clots develops from the heart and then travels from the heart to the blood vessels that supply blood to the brain and occludes or narrows these blood vessels. So your brain does not get enough, an adequate supply of blood, resulting in a stroke. Second, the transient ischemic attack. This is also called a mini stroke. So in transient ischemic attack, there's a temporary decrease in the blood supply to the brain, and it can last as little as 5 minutes. Just like ischemic stroke, a transient ischemic attack occurs when there's a blockage to the blood supply to the brain caused by a blood clot or a fatty deposit or plaque. So in transient ischemic attack, you get some of the symptoms of stroke. The patient still shows some of the symptoms of stroke, but it resolves spontaneously, like it resolves after some time. What is the hemorrhagic stroke? So the hemorrhagic stroke accounts for 15% of all the cases of stroke. This type of stroke occurs when the blood vessels in the brain ruptures or leak. It is caused by any condition that affects the blood vessels, like long-standing untreated hypertension. 2. Ruptured aneurysm. An aneurysm is a bulge in the artery in the brain. So when an aneurysm ruptures, it could lead to a hemorrhagic stroke. 3rd is trauma to the head, which could be as a result of road traffic accident or fall. And lastly, overtreatment with anticoagulants or blood thinners. Symptoms of stroke. First, trouble speaking or understanding what others are saying to you. Second, altered level of consciousness. Third, paralysis or numbness of the face, the arm and the leg. And this basically just affects one side of the body. So one thing that you can do is to tell them to raise their hands above their head, and then you observe them. If you notice any difficulty in raising a particular side of the arm, then they could be having a stroke. Or if they raise a arm and one side of the arm drifts downward, then they could be having a stroke. Another thing you can do is to try to tell them to smile. So when you notice that their face, one side of their face droops while they are trying to smile, then they could be having a stroke. So 4th is trouble with vision. So when they complain of blurry or blackened vision in one or both of their eyes, then they could be having a stroke too. Another is headache. When they are complaining of a sudden headache that might be associated with vomiting or dizziness, then this could be a stroke. And then lastly is trouble walking. Because one side of their body is already weak, you see them stumbling and staggering while walking. So in transient ischemic attack, you might get some of these symptoms of stroke, but it resolves after some time. This is still an emergency. So after these symptoms resolves, please head to the nearest hospital, report your problem to a doctor so that you'll be placed on a medication to prevent a further occurrence of stroke. Report has it that after an transient ischemic attack, your chances of getting an ischemic stroke increases. Diagnosis of a stroke. A brain CT scan is the most important diagnostic tool which is used to confirm the diagnosis of a stroke. So a brain CT scan tells us whether the stroke is an ischemic stroke or a hemorrhagic stroke. So along with a brain CT scan, the doctor also orders for some investigations and some labs like your complete blood count with differentials, your lipid profile, your kidney function test, your HbA1c, to see how your blood sugar level control has been like for the past 3 months. In addition to that, your doctor may also order for transcranial Dopplers, carotid Dopplers to screen the carotid arteries that supply blood to the brain. So in addition to that, the doctor may also request for ECG, electrocardiogram, echocardiogram, and also prolonged ECG monitoring called Holter monitoring to rule out a cardiac cause of the stroke. Treatment of stroke. The treatment approach to stroke depends on the type of stroke, the duration of the stroke, and the severity of the stroke. For ischemic stroke, treatment starts with taking drugs that breaks the clot and prevents further clot formation. So for an ischemic stroke, if you present to the hospital within 4.5 hours after the presentation of a stroke, you are given a tissue plasminogen activator, which is a clot buster. So this medication helps to reverse the effect of the stroke, reverse the symptoms of the stroke like the paralysis and the rest of them that we discussed in our symptoms of the stroke segment. So for ischemic stroke, if you are lucky to present within 4.5 hours after the presentation of your stroke, you get a tissue plasminogen activator, which is a clot buster that breaks down the clot and reverses the symptoms of your stroke. So you just need little rehabilitation and then you're back to your feet again. Treatment of hemorrhagic stroke focuses on controlling the bleeding and reducing the pressure in the brain. Depending on the location, the cause and extent of the hemorrhage, a surgery may be needed to reduce the swelling and also reduce the pressure in the brain. So in all, we cannot talk about the treatment of stroke without talking about rehabilitation. Rehabilitation is one of the fundamental treatment plans to help people in the recovery of stroke. This will be covered fully in my next video. So make sure you subscribe to my channel and turn on the notification bell so that you instantly get notified when I upload this video. Risk factors for stroke: uncontrolled hypertension, high level of cholesterol, diabetes mellitus, obesity. A family history of stroke also puts you at risk of having a stroke. Age: if you're 55 years and older, you're at risk of getting a stroke. Heart disease: if you have any heart disease like a coronary artery disease, you're at risk of getting a stroke. Also, if you're a smoker, if you take illicit drugs like cocaine, methamphetamine, you are at risk of getting a stroke. And people who consume alcohol excessively, you are at risk of getting a stroke. Prevention of stroke. First, controlling your blood pressure, lowering the amounts of saturated fats and cholesterol in your diet, maintaining a healthy weight, eating diet rich in fruits and vegetables, managing your blood sugar level properly if you're a diabetic patient, quit smoking, exercising daily, and reduce the consumption of alcohol. Drink moderately. So we've come to the end of this video about stroke. What are your questions and assumptions about stroke? Please, I would love to see them in the comment section. If you know that this video was of immense value to you, why not share it with your loved ones and also help to educate them about stroke? It's been an interesting time with you. Thank you so much for sticking with me to the end of this video. Until next time, stay healthy, mind, soul, and body.